The consultation you're about to listen to is not a real-life consultation, but it's representative of what you may encounter in real life. I'll show you exactly how I go about analyzing and reviewing a case. It is useful when you're reviewing your own consultation to be as objective as you can. It is difficult to be objective when you're listening or watching back your own consultation, but try to listen or review it with the lens of somebody else who's actually listening or watching it. I usually try to review the case from a third person's perspective. Hello, this is Dr. Kwun. Is this Mr. Gray?
Hello, hi Dr. Kwun. Yeah, this is great. Thank you for calling me.
How can I help?
I don't know if I'm wasting your time or not, doctor, but my daughter asked me to call. She's getting a bit worried about me. Just I don't know. Maybe it's the way I'm treating her or the way I'm around her, but I don't know, doctor. I just feel sad all the time. I don't know how to control it. Sometimes just crying for no reason. I just feel awful, really bad, doctor. I just can't. I'm not sleeping. I'm not eating. I don't know what to do. And I just feel like I need something from you, or something. I don't know. My wife, she died recently. She died 3 months ago now. It's coming up to her birthday as well. So it's the first time I'm going to be alone without her over her birthday and over Christmas.
I can appreciate it's very difficult, and I'm sorry to hear about the loss of your wife. You're not wasting our time at all. I think it's a good thing that you called today. And you mentioned how you're feeling sad and very low at the moment. So it's one of those things that's very difficult to deal with, especially when you've lost somebody who you've been close to.
Yeah.
I need to ask you a few more questions, if that's okay.
Yeah, go ahead, doctor.
The doctor started with an open question and listened attentively to what the patient had to say. This encouraged the patient to contribute to the story. The doctor showed good listening skill and responded to the patient's cue about the loss of his wife. He also empathized with the patient. As you might have noticed, there was a point when the doctor actually was interrupted by the patient because the patient thought that the doctor has finished his sentence. Have you felt that your mood is low every day?
Yeah, pretty much for the last 3 months now. I can't see what's the point anymore.
And have you lost your energy as well?
This whole year has been rough because since the start of the year, I've just been looking after her and caring for her. I've just been focusing all on her, but now that she's gone, I've got nothing to do. I don't want to do anything.
Are you still talking to your daughter regularly?
Yeah, but they're good as gold, my girls. I've got 2 daughters, and they pop round as much as they can. They keep calling me every day, and I tell them I'm fine, and I'm eating for myself. I'm trying to eat and things like that, but there's only so much they can do because they got families of their own now.
The doctor asked a specific question to explore the history of presenting complaint and inquired about any problem with the patient's mood and energy level. It's important in data gathering that the doctor takes a focused history to allow a safe assessment. So there are other questions that could have been asked in this scenario, but due to time constraint, it's important to be careful which question you're asking. The doctor followed by asking about support and asked about the patient's daughter. Exploring patient support in this case scenario is relevant because of the loss of somebody very close to the patient. So it sounds to me that you're quite concerned about your mood and you don't really want to carry on living. Sometimes when people feel a bit low, they feel like they want to hurt themselves. Have you had any thoughts like that?
I haven't actually done anything to myself, no. I just think, why? What's the point? And sometimes I just think it'd be better if I just weren't here.
Have you had any thoughts of ending your life yourself?
No, I can't think of anything.
Or any thoughts of harming others at all? This seems to be very hard at the moment. Was there anything in particular you were hoping we could do to help you, Mr. Gray?
I don't know if there's a pill that I need to take just to help me sleep and just make me feel a bit better. Just because like I said, I'm just not sleeping these days, and I just barely eat as well. I don't know if there's any drugs that I need to take.
The doctor reflects back on what the patient said and gathered that the patient is concerned about his low mood and not wanting to do anything since his wife died 3 months ago. The doctor explored the patient's agenda and asked directly the patient what he was hoping from this consultation. The risk assessment was conducted professionally. The doctor used signposting before asking sensitive questions to the patient. There's certainly things that we can do to help you with sleep. We'll talk about that in a moment, but tell me a little bit about how's your sleep at the moment.
So, I don't know, I'm not sleeping these days. I just like, at night, I try to go to bed like normal. I get to bed, sort myself out, and I'm just lying there just thinking over and over, what could I have done for her? What could I have, could we have done something earlier? Could we have picked up on something? I don't know.
I appreciate that you've been having these thoughts, and you seem to have a very busy mind when you're going to sleep and thinking about a lot of things on your head. Do you feel that you get a few hours of sleep at night? How many hours do you think you'll get?
Maybe 2, 3.
Okay. And is there like a regular time when you go to bed?
Most of the time I try and get to bed around 11, 12 o'clock, midnight time.
Okay.
Rolling around thinking, getting up, going around, trying to tire myself out, go back to bed,
Okay.
get up again. I don't know.
Right. So you're tossing and turning in bed at the moment and not getting to sleep. Sleep seems to be a major problem that this patient is experiencing, and the doctor pick up on this cue and explore the sleep pattern of the patient. The other thing is sometimes when people feel they're low and not sleeping, they turn to alcohol. Have you been drinking alcohol?
No, I don't drink.
Okay. Have you been smoking at all?
No, I don't smoke.
Okay.
Well, I've died of lung cancer, so we're big on not smoking here.
That's very sensible. At the moment, your daughters are in touch with you. How are you coping with getting your groceries and doing your daily activities at home?
Like at the moment, I'm just ordering. My daughters are helping order my food in for me and stuff like that. There's some ready meals. I just pop them in the microwave or the oven. But often or not, I just don't want to eat them.
It's a very good thing that you've got in touch with us, because there are things that we can help you. I know that the sleeping is a problem. There are things we can do to help you in terms of sleeping. But I think what's going through at the moment is that you're going through a bereavement period, and it's quite difficult, and your mood has been very low as well. The doctor explained his working diagnosis to the patient, explaining that he's going through a bereavement period and is currently grieving. There are medications sometimes people find useful. There's talking therapy as well. So was there anything in particular you thought would be helpful to you?
Having a chat with you certainly helped me today. Anyway, I just feel a bit better after talking to someone other than my daughters, because they just nag. So, just having a chat with you has certainly been quite good, doctor.
Do you think you'd be interested in talking with somebody on a regular basis to have a therapist? There's a service called Cruise, which is quite good for people who are going through bereavement, and I can give you the details of this service, and you can get in touch with them. They'll be able to provide you some support.
All right. So what do they do there?
So what they can do is they can give you some advice and talk to you, and they can provide you with some support in terms of talking therapy.
Maybe worth having a chat with someone, yeah?
So that's something that you could try if you'd like. The other thing is, if you're struggling getting off to sleep, we could try you on something to reset your sleep cycle to make sure that you sleep. So that's something that we could try. There's something called promethazine that we could try on a short-term basis if you'd like.
Yeah, I think definitely like getting to sleep is going to help me during the day as well, so I can actually do my daily things again.
So we could try that, and then I think the other thing is to make sure that you have good sleep hygiene, because that will also help in terms of getting good sleep. So make sure that you don't nap during the day. Make sure that you're going to bed at the same time every day, and you can also try to do something relaxing just before going to bed. Some people like to play a relaxing music or read a book that can get them off to sleep. So you could try that and see whether that helps. All right?
All right, I'll try those things, though.
The doctor also involved the patient in the shared management, offering different options. The doctor remembers the patient's agenda and readdress the sleep problem. So he offers medical management to reset the patient's sleep with promethazine. This is a sensible short-term measure to help with sleep problem. The doctor also discussed sleep hygiene with the patient. However, the sequence of the discussion could have been more organized if the doctor decided to discuss the sleep hygiene first and then discuss the medical management of the sleep. What I suggest we do is that try this promethazine tablet once a day for the next 7 days. Take it about 45 minutes before going to bed. Okay, it will help you to go off to sleep. Sometimes some people may feel a little bit groggy in the morning with it. If you have any problem taking it, please let us know, and then we can change to something else. The doctor also discussed about the side effects of promethazine and explained clearly to the patient how to take the medication. This is a good demonstration of evidence-based decision regarding safe prescribing. Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down in the description below to book a call with me to see how I can help you to pass your exam. Give the cruise service a call and then they'll be able to help you. In 3 weeks' time, give us a ring to see how things are so we can touch base. Is that all right?
That sounds perfect, doctor. Thank you.
If you're finding that you're not coping or your symptoms is getting worse, you're feeling lower in your mood, please get in touch with us, then we can reassess you. All right?
All right, thank you very much, doctor.
Whilst this is not a perfect consultation, the doctor managed to take a focused history and made a safe assessment of the patient, exploring the psychosocial elements of the case and showing empathy during the consultation. There were moments in the consultation when rapport was broken. However, the interpersonal skill was adequate to show empathy and the doctor readdressed the patient's agenda. The doctor involved the patient in the clinical management. However, the sequence of the discussion could have been improved, starting with lifestyle modification before discussing medication. Let me know what you think of the review of this consultation. If you have any suggestions or any questions, or if there's anything that you don't agree in the consultation, please let me know down in the comment section. I look forward to reading your comments.
Hi, Dr. Erwin. Thank you very much for this wonderful session. In fact, this is the best session I've ever attended for SCA, to be very honest. And I'm very grateful for it. Unfortunately, I had a brief moment to jump out to attend to an emergency. I wanted to check with you, what in situations where you're taking the history and it's only 6 minutes, you find out that you're not able to hold on to something concrete in terms of the diagnosis. I think that could affect one's confidence in, trying to discuss management with the patient. How do you go about that? Because that's happened when I'm trying to practice with some of my friends sometimes, to find out that it's only 6 minutes, I've been to the 7th minute, I've not been able to get anywhere with the case. I don't know what the specific diagnosis is, and maybe I've got a lot of stuff on my mind. how do I manage that kind of situation? How do I come out of it?
It's about managing uncertainty. Now, there might be cases where the examiners want to test your management of uncertainty. So they won't give you specific clues as to what is a diagnosis. So it's vague. What you want to do there is embrace uncertainty. As long as you've ruled out the serious pathologies, the things that is really expected of you at the level of a GP to make a safe assessment, then you can reassure the patient, let them know that you've checked for this, you've checked for that, and you couldn't find anything concerning. And what you're going to do to find out more about this problem, it could be that you may need to do some further investigations. It could be that at this point, there's no need for an investigation. However, if you do develop these symptoms, please get in touch because we'll need to reassess you. So as long as you do that, then you're going to score marks. There could be a case where the patient might worry that they have IBS, for example. And that is one of the concern. But in your history, you couldn't find a possible cause for these symptoms that they're having, the bowel symptoms. Then you can explain that IBS is not a diagnosis that we make on a first presentation. It's important that we rule out other things first. So I would recommend in the first instance, let's arrange some blood tests to check whether you don't have any problems with your gut. So for example, you might need to do some blood tests. You might need to check a celiac screen. So there are things that you can still do to progress the workup if you don't know what's the problem. Now, there are cases when there's already been extensive investigation, and the answer here is not to give more investigation. One of the cases was the lady who had gynae problem and had various investigation in the case example. So this is medically unexplained symptoms. So the management here is more about psychosocial, managing the pain, and also possible referral to pain clinic to get on top of the pain. If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.